Cyanotic heart disease, defects that increase pulmonary blood flow. In transposition of the great vessels, the aorta arises from the right ventricle instead of the left, and the pulmonary artery arises from the vena cava to the right atrium, then flows to the right ventricle and goes out into the aorta to the body completely deoxygenated. It returns again by the vena cava. A secondary source of blood enters the heart from the pulmonary artery to the lungs to be oxygenated and returns to the left atrium. A second closed circulatory system, this severe disorder is incompatible with life because the oxygenated blood never reaches the aorta. Fortunately, in most instances, ASD and VSD are also present, turning the entire heart into a mixed circulatory system that does supply some oxygen to the body. Transposition tends to occur in large newborn 9 to 10 pounds and occurs more often in the boy than girls. The disorder accounts for about 5% of congenital heart anomalies. In further assessment, infants with this disorder are usually cyanotic from the moment of birth. There may not to be a heart murmur present, or there may be various murmurs, depending on the shunting of blood through atrial or ventricular defects or through the ductus arteriosus, which usually remains open. Echocardiography generally reveals the enlarged heart. Cardiac catheterization will reveal the low oxygen saturation resulting from the mixing of blood in the heart chamber. And for the management, if no septal defects exist or if the defects is too small to allow enough mixing of blood to sustain life, a prostaglandin will be administered to keep the ductus arteriosus patent and allowed for a route of blood between the aorta and pulmonary artery. A balloon atrial septal pull-through operation may be done by cardiac catheterization to enlarge the septal openings. With this procedure, a deflated balloon catheter is passed from the right atrium through the foramen ovule into the left atrium. The balloon is then inflated and the catheter is drawn back into the right atrium, enlarging the opening of the foramen ovule and creating an artificial ASD. Surgical correction of transposition of the great arteries is done at 1 week to 3 months of age and consists of, as the name implies, switching the placement of the pulmonary artery and aorta back to their usual positions. Because this involves surgery, the child will be transported to a major center for surgery and care. Even with this significant heart disorder, to survival rate following surgery as high as 95%. Children need follow-up as they grow older to be certain that narrowing of the surgical sites does not occur, leading to less heart function as they grow older.